This next question, Congressman Wolf, you'll answer first. What measures would you propose to improve the affordability, and I'll add the word availability, of health care to our citizens without the system becoming socialized? 3 minutes.
We need to make health care more accessible, more affordable. We also have to make sure that we keep it between the doctor and the patient and not involve the federal government in it. I think the proposal that has been made with regard to Senator McCain and many others with regard to a $5,000 tax credit. Most people receive their health insurance through their place of employment. That would also help employers, both large and small, to do it. But also the $5,000 tax credit would allow you to take it some other place, for realtors to band together, for small business to band together, also for the portability for you to take a place. I have worked on a number of these issues and co-sponsors of a number of the bills in Congress, have also worked for putting more money into research with regard to cancer research, with regard to breast cancer, with regard to pancreatic cancer, with regard to some of these things. We've also passed the genetic non-discrimination bill, whereby if someone has a genetic disposal toward a health care problem, they cannot be dropped. We also passed, just in the closing days of the Congress, mental health parity, whereby mental health can be treated the same way. But there are a number of things, but we do not want the federal government to run this the way it was done in the Clinton health care proposal.
Ms. Feder, 3 minutes.
Well, on health care, we have another real contrast between myself and Mr. Wolf. I believe that every American ought to have affordable health care. And let me talk a little bit, since Mr. Wolf, you seem to favor it, about Mr. McCain's plan. Mr. McCain has said that he wants to deregulate the health insurance industry the way we've so successfully deregulated the banking industry. I think that that is not the way we want to go, and let me tell you why. He wants to tax our health benefits. And the experts tell us that when he does that, it's going to leave about 20 million people losing the insurance they now have, the plans that they have. And if that's not interference with what we've got, I don't know government interference, I don't know what is. And he's going to send them into the marketplace with a $5,000 tax credit for insurance that costs for a family $12,000. And not going to protect anybody against discrimination based on pre-existing conditions. Well, actually, if John McCain had to go shopping for health insurance under those circumstances, with his life circumstances and health status, he wouldn't be able to find health insurance. I believe that we've got to give everybody a choice of health plans. You like your plan, you stay in it. But if you need a new one, you need to have one available to you that is not going to discriminate against you based on pre-existing conditions. We need to give everybody benefits that are going to really protect us when we're sick, as good as members of Congress have. They've got it. Shouldn't we have that? We've got to make it affordable, and I've got to make sure that people always have a choice of their own doctor as well as their own health plan. Now, we've got a lot of scare tactics when it comes to health care. I want to be really, really clear. Don't let anybody tell you that what I'm putting forward is a government takeover. It's about you choosing in a world where the insurance companies can't discriminate against you.
1 minute for a rebuttal, Congressman Wolf, if you like it. No? We'll pass on rebuttals.